Welcome. Today we're diving deep into a heart condition that often flies under the radar: coronary microvascular dysfunction, or CMD. While many are familiar with blocked arteries, CMD focuses on the smaller vessels of the heart. Join us as we explore the complexities of this often misunderstood disease. So, what exactly causes CMD? Unlike typical heart disease, it's not primarily about plaque buildup in large arteries. Instead, CMD arises from problems of the structure and function of the tiny blood vessels within the heart muscle, the coronary microvasculature. These vessels, less than a millimeter in diameter, can become damaged or constricted. Factors contributing to this dysfunction include high blood pressure, high cholesterol, insulin resistance, diabetes, smoking, and even hormonal changes like those experienced during menopause. Chronic inflammation and oxidative stress are also thought to play a significant role. Now let's delve into the inner workings of CMD. Normally, these microvessels dilate to increase blood flow when the heart needs more oxygen, such as during exercise or stress. In CMD, these vessels struggle to dilate properly. This impaired dilation leads to reduced blood flow to the heart muscle, causing ischemia or oxygen deprivation. Over time, this can trigger a cascade of problems, including inflammation, endothelial damage, and even changes in the heart's structure and function. The lack of adequate blood flow can also sensitize nerve endings in the heart, contributing to chest pain even when the large coronary arteries are clear. Understanding how common CMD is challenging, because it's often overlooked or misdiagnosed. Its true prevalence remains unknown. However, estimates suggest it affects a significant portion of individuals experiencing chest pain who don't have blockages in their major coronary arteries. It's more prevalent in women, particularly after menopause, and in individuals with diabetes, high blood pressure, or other risk factors for cardiovascular disease. The symptoms of CMD can mimic those of traditional heart disease, making diagnosis tricky. The most common symptom is angina or chest pain, which can feel like pressure, squeezing, or burning. Unlike typical angina, CMD-related chest pain may be more prolonged, occur at rest, or not be consistently triggered by exertion. Other symptoms may include shortness of breath, fatigue, and palpitations. Women may experience more atypical symptoms, such as pain in the jaw, back, or abdomen. Diagnosing CMD requires a multifaceted approach. Because standard angiography might not reveal any blockages, specialized tests are needed. These may include coronary flow reserve testing, which measures how well the microvessels dilate in response to a stimulus. Other tests, such as cardiac MRI or PET scans, can assess blood flow to the heart muscle and detect areas of ischemia. Emerging techniques like microvascular angiography are also showing promise in visualizing and assessing the microvasculature. While there isn't a single, universally accepted classification system, CMD can be broadly categorized based on its underlying causes or associated conditions. Some individuals may have CMD due to endothelial dysfunction, while others may have structural abnormalities in the microvessels. It can also be classified as either being associated with coronary artery disease or occurring in the absence of overt epicardial coronary artery disease. Managing CMD focuses on alleviating symptoms, improving blood flow, and reducing cardiovascular risk factors. Lifestyle modifications are crucial, including quitting smoking, adopting a heart-healthy diet, and engaging in regular physical activity. Medications may include nitrates or calcium channel blockers to help relax the microvessels, ACE inhibitors or ARBs to manage blood pressure, statins to lower cholesterol, and medications to control blood sugar in individuals with diabetes. In some cases, medications to reduce inflammation or improve endothelial function may also be considered. Preventing CMD involves addressing modifiable risk factors. This means maintaining a healthy blood pressure and cholesterol level, controlling blood sugar if you have diabetes, avoiding smoking, and leading a physically active lifestyle. Adopting a heart-healthy diet rich in fruits, vegetables, and whole grains is also essential. Regular check-ups with your doctor can help identify and manage risk factors early on. The prognosis for individuals with CMD can vary. While CMD is not typically fatal, it can significantly impact quality of life and increase the risk of other cardiovascular events. Early diagnosis and appropriate management are key to improving outcomes. Ongoing research is focused on developing more effective diagnostic tools and treatments for CMD. Emerging therapies targeting endothelial dysfunction and inflammation hold promise for the future.